So same day outpatient total hip replacement or total knee replacement is not something that's new. It has been around for a little while. Now there are specific protocols and programs that have been built over the last 5 to 10 years that work very well in certain areas or certain facilities. But it is really something that each year and at the time right now is starting to surface and starting to kind of be the standard of care. Joint replacement can be very expensive. Patients staying overnight in the hospital for multiple days can be very expensive. The outcomes and complications show that it is very safe to be done. Now listen, not every single patient that I see is going to be a great candidate for an outpatient surgery, but I would say it's very minimal the patients that can't have an outpatient same-day surgery. So when I see a patient in the office and they have decided or they've failed all conservative management and now we're going to talk about surgery, we go through the whole process. I explain to them that they're going to have the surgery that day, that we're going to do their surgery in the morning, they're going to go home in the afternoon. Everything that we do from the moment they get to the hospital in the preoperative area to a spinal block for the surgery to any type of regional blocks around the knee, everything is all shaped around being able to get the patient up and moving as soon as possible in a safe manner so that they can go home and rest and recover in their own home. Once they get home, we have a home health care company that comes to the house for the first 2 weeks, 2 or 3 times a week. And really all they're really doing is making sure that the patient's either A, walking safely throughout the house with their walker or their cane, make sure that their dressing or their bandage is dry and clean and they're not having issues with that. If they're a knee replacement, making sure that they're doing some light range of motion exercises because we're not going to get them into a formal therapy program until their 2-week appointment. So I would say at this point in time, I think for the last year, I just saw the numbers the other day, we're at about 90% of our surgeries that I'm performing personally are performed in the same day outpatient setting. And I think there continue to be studies coming out, research being done that continues to show that the programs and protocols we have for it are very safe and efficient.